Welcome to the first episode in our medical ethics series. Whether you are just starting your journey in healthcare or you are early in your career, this series is designed to help you understand one of the most important aspects of medicine: ethics. So, what is ethics? Ethics are the standards we use to decide what is right and what's wrong. They help guide our choices, our actions, and the way we treat other people. In everyday life, ethics show up when we ask questions like, should I tell the truth even if it's uncomfortable? What is the fair thing to do here? How can I respect someone else's boundaries? What is the responsible choice in this situation? Ethics are not abstract ideas. They are practical tools that help us live together, solve problems peacefully, and build trust with the people around us. Everyone uses ethics, whether you realize it or not. Ethics is also the study of right and wrong, good and bad. It's about making choices that align with what we believe is right. Every day, we face ethical decisions in our personal and professional lives. Ethics guides us in answering complex questions. It's the framework we use to navigate difficult situations, helping us decide what we should do, not just what we can do. What are the systems that are in place to help control the issue of ethics or make sure it exists and functions? 5 systems. Throughout human history, societies have developed various systems to guide and enforce ethical behavior. So the realization that living by ethical standards is important is a long-lived one. Understanding these systems help us see where professional ethics fits in the larger picture. We have the laws, the rules, the morals, the values, the etiquette. Laws, these are formal rules created by governments that everyone must follow. They are enforceable and represent society's minimum standard of acceptable behavior. Rules, these are specific guidelines established by organizations or institutions. They apply only to people within the particular setting and help maintain standards. Morals, these are personal beliefs about right and wrong that come from our upbringing, culture, religion, and life experiences. Your internal compass. Values, the principles and priorities we hold dear. They represent what we consider important and shape our character and decisions, and they are usually shared among different cultures, communities, and groups. Etiquette, these are the unwritten societal norms that guide polite and respectful behavior, helping us live together harmoniously in the society. So these are the 5 systems that guide ethical behavior. Laws, and these are enforceable, and this enforcement happens through penalties, jail time, fines, whatever. Rules, these are organizational guidelines, and they are kind of specific to certain settings or situations. Morals, this is your internal compass. Okay? The personal beliefs about right and wrong. Values, these are core principles we hold dear and prioritize, and this is shared and known and desired by groups, communities, or societies. Societal etiquette and written societal norms for respectful interactions. So ethics actually is not only medical. It exists across professions. Every profession that serves the public carries special ethical obligations. Okay? With professional knowledge, authority, and public trust comes responsibility. Consider how different professions uphold their ethical duties. For example, teachers. They treat students fairly without favoritism, create safe learning environments, they protect students' privacy, maintain appropriate boundaries, inspire love of learning. This is achieved through ethics and ethical behavior and professional ethics. Lawyers maintain strict client confidentiality, serve justice over winning, avoid conflict of interest, prioritize zealous representation within ethical bounds. Engineers design for public safety above profits, protect communities from harm, maintain honesty in calculations and materials, prioritize environmental responsibility. Journalists report truthfully and accurately, verify sources rigorously, minimize harm while seeking truth, and remain independent from influences, correct errors transparently. So the common thread, with specialized knowledge and authority comes responsibility. The public trusts professionals to use their expertise for good, not for personal gain. So why medical ethics is different? While all professions bear ethical responsibility, medicine is held to an extraordinarily high standard. The stakes are uniquely profound, and consider, for example, what patient entrust to you. People's lives, people's health, and people's well-being. People's lives, this is the ultimate trust, their very existence and survival. People's health, their quality of life, ability to function, freedom from suffering. And the well-being is about their dignity, autonomy, and the deepest fears and hopes. Patients come to you when they are vulnerable, and when they are afraid, and when they are in pain. They trust you with life and death decisions. They share their most private information. They place themselves quite literally in your hands. To be able to put yourself in that, this requires extraordinary trust. And extraordinary trust comes with extraordinary responsibility. So, if you compare the other professions with medicine in terms of how high the stakes are, let's say a mistake in accounting might cost money. And that's serious, but it can be recovered. Businesses can rebuild. Financial losses, while painful, are ultimately reversible. A mistake in medicine, on the other hand, can cost a life. This cannot be undone. There are no second chances, and the finality is absolute. The responsibility is profound. So the sobering truth here is, without ethics, medical knowledge becomes dangerous. Technical skill without ethical grounding can cause tremendous harm. You must commit to both excellence in knowledge and excellence in ethics. They come together. There is this concept in medicine that's called the therapeutic relationship. It's built on trust. We keep coming back to this trust issue. Very important. The physician-patient relationship is unlike any other professional relationship. It's the foundation upon which all medical care rests. Understanding its unique nature is essential to ethical practice. It's not a business transaction where goods are exchanged for payment. It's not a simple service contract. It's not a one-time interaction without deeper meaning. It's not a power dynamic where one party controls the other. It's a relationship built on trust above all else, the foundation of all effective medical care, essential for healing, both physical and emotional, and it's a sacred covenant between vulnerable person and a caregiver. Without trust, everything falls apart. Patients won't share symptoms. They won't follow treatment plans. They won't return for follow-up. They won't be honest about their lives, and the entire therapeutic process collapses. It's at the heart of all medical ethics. It's this sacred relationship. This is not simply a business transaction or a service contract. It's therapeutic relationship built on trust. You need to protect information. You need to recommend what's in their best interest. You need to respect and honor their dignity. You need to listen to their concerns and take it seriously. Without this trust, patients might hide symptoms, refuse treatment, or avoid seeking care altogether. Trust makes everything else possible. Building and maintaining this trust requires healthcare providers to be ethical, not just in major decisions, but in every interaction. Okay? So building trust, that's what patients must believe or must rely on or must trust here. Okay? Now we come to, I think this is the commonest information or the commonest knowledge that people know about ethics, the 4 principles of medical ethics. Medical ethics rests on 4 foundational principles that guide decision-making in healthcare. These principles, first articulated by ethicist Dr. Tom Buchman and James Childress. They are American philosophers. But I would argue that these ethical principles are centuries old. They have been there all the time, but they were able to articulate them, organize them, and give them these names and definitions. They have become since the cornerstone of medical ethics worldwide. Autonomy, justice, beneficence, non-maleficence. Autonomy is patients have the right to make their own healthcare decisions. It recognizes that each person is the expert on their own life, values, and priorities. Justice, the principle of fairness in medical care, treating similar cases similarly and distributing healthcare resources fairly without discrimination. Beneficence, the obligation to act for the benefit of the patient, actively promoting well-being, healing when possible, and relieving suffering. Non-maleficence, first do no harm. Healthcare providers must avoid causing harm to patients and carefully weigh risks versus benefits. Understanding principles is just the beginning. The real challenge is putting them into practice every day. Respecting patients' autonomy requires concrete actions throughout every interaction. This is just some of them. Ensure privacy and confidentiality. Provide clear, honest information. Respect patient decisions. Obtain proper informed consent. All these pour into maintaining and upholding autonomy. Upholding justice. First of all, start by yourself. And this is usually what I tell people. Start by looking inside yourself. To uphold justice, you need to examine your own biases. Treat every patient with equal care, regardless of the background or insurance status. Advocate for fair resource distribution. Speak up against a discrimination. Work to reduce health disparities. Stay current with medical knowledge and best practices. Understand each patient's unique situation. Recognize that benefit looks different for different people. Go beyond treating disease to promoting overall well-being. This is beneficence. What about non-maleficence? Practice within our scope of competence. Again, look at ourselves. What is the scope of what I know? What is the scope of my practice? I need to limit my practice to that scope. Ask for help when needed. Humility. Be humble. If you don't know, ask for help. Be vigilant about patient safety. That's an issue very well goes into non-maleficence. You don't want to hurt patients. Be honest about mistakes. Because when you are honest and forthcoming about that, they can be corrected. Consider physical, psychological, social, and financial harm. The whole patient. This is professionalism. This is a related concept, but it talks about how you conduct yourself within the professional setting. It's not only about medical settings, but in the medical setting, medical professionalism encompasses the conduct, behavior, and character expected of the healthcare provider. It includes competence, integrity, respect, compassion, and accountability. The things that you can do to maintain professionalism, you need to maintain punctuality and preparation. Arriving in time is respectful to everybody, the patients, your colleagues, and the setup. Clear communication with the patients, with your colleagues, and maintaining appropriate boundaries with your patients. Accountability. Take responsibility for actions and learning from mistakes. That's very important. Not trying to blame others for your mistakes. That's unprofessional. Collaboration. As we know, and I keep saying, nowadays, healthcare is provided through teams. That lone wolf mentality is over. No more of that. So you need to be collaborative. You need to be respectful. You need to be a team player. Respect. And that's for everybody. Dress appropriately. Maintain professional demeanor. Talk and communicate respectfully for everybody around you. As a healthcare provider, the responsibility continues outside the professional setting. You represent your profession to the community. This doesn't mean you can't have a personal life, but it does mean conducting yourself in ways that maintain public trust in the medical profession. Social media posts, behavior in public, and how you discuss your work all reflect on the profession. Patients who see their doctor behaving irresponsibly or unethically in public may lose confidence in that doctor's medical judgment. Professionalism also includes taking care of yourself, because burned out, exhausted healthcare providers cannot provide ethical, high quality care. Part of your professional responsibility is maintaining your own physical and mental health so you can serve your patients effectively. Why does all of this matter? Why invest so much energy into ethics, professionalism, and relationship building? Because they result in better patient trust, better clinical decisions, better team function, and better outcomes. Ethical practice directly leads to improved healthcare outcomes and patient satisfaction. Ethics is not separate from medical excellence, it's essential to it. You can't be a truly good doctor if you possess knowledge and skill but lack ethics. Excellence in medicine requires the integration of knowledge, skill, and ethical practice. So, the goal of all medical training is to produce healthcare providers who are knowledgeable, skilled, and ethical practitioners who can be trusted with people's lives and health. As you begin your journey in medicine, remember that every interaction, every decision, and every action helps or shapes the kind of healthcare provider you will become. In our next episode, we will dive deeper into the principle of autonomy and explore informed consent, capacity, and what to do when patients make decisions we don't agree with. Aim not just to treat disease, but to care for people, and work not only to maintain standards, but to build trust. Thank you. See you next time.